Welcome to Modern Aesthetics Journal Club. I'm your host, Rebecca Kazin. In this edition, we'll be talking about the treatment of sagging skin on the neck, known as submental fat, an area that has proven elusive even amid the boom of non-invasive injectable treatments in the last decade. Kythera's investigational ATX-101 was recently approved by the FDA and will soon be on the market. We sat down with Dr. Susan Weinkel at the recent AAD meeting in March to discuss the latest data on ATX-101 and how it will shape the injectable landscape.
Submental fat has definitely been a challenge for us. First of all, there are devices on the market which cause fat cells to rupture. However, they're clamped on. It's not very easy to clamp on anything in this area. So it's been amazingly difficult to address this. Now, historically, you can have liposuction, but there's a huge set of patients that don't want anything invasive. They want a non-invasive, just like our other procedures that we do with fillers and neuromodulators, they're non-invasive and give an excellent outcome. The submental fat is an interesting story because you see submental fat in thin people. Just genetically, it's an area where you see fat deposition, even though their total body weight is very low. You see it in young people, thin young people, heavier young people. You see it in older people, men, women. So it's an amazingly broad range of patients that are bothered by this submental fat area. ATX-101 is sodium deoxycholate, and that's a product that causes adipocytolysis, and that means an actual rupture of a fat cell. So if we can decrease the number of fat cells in this area and have inflammation, which then maybe we'll see some potential slight amount of tightening of the skin, I think it has great potential for us. We've had the clinical trials, and I had the pleasure and opportunity to participate in 2 of those clinical trials, so I personally have had some experience with it. I think it's so exciting. I've been a dermatologist 35 years, and I can tell you that for the first 20 years of my practice, we really had a plateau. In the last 10 to 15 years, we've seen it gradually evolving, I would say exploding for the number of things we can do. First of all, we have amazing patient interest. Patients, and this generation of the patients we're treating, they want something today, they want little downtime, and they want an excellent outcome. I think the technologies are evolving with devices, with the injectables, longer lasting injectables. I see on the forefront, before you know it, our cupboard is going to be crowded. I think we have to build a new cupboard.